How do you treat that conservatively?
Decongestants, saline irrigation, conservative sort of supportive care, anti-inflammatories for your symptoms of pressure and discomfort and headache. And then if it worsens at the end of that first week, if you begin to notice that your symptoms are not improving but are getting worse, you begin to notice more exudative, infectious looking nasal drainage, more facial pressure and pain, progressive symptoms, then it's reasonable to start thinking about an antibiotic therapy. And there's not really an accepted time period for antibiotic therapy for acute infections, but most of us would give a 10-day course of an antibiotic and then check back with your physician to ensure that you're responding appropriately.
Do most people respond before the antibiotic, the first 5 or 6, 7 days? You said saltwater irrigation, saline irrigation. What do you mean, saltwater spray?
Any of the above. You know, there are misting saline sprays, there are neti pots, there are squeeze bottle irrigation sets, and there are even some battery-powered pressure washing devices that are much like a water pick we used to use for our teeth. And any of those are fine to lavage the nose.
So decongestants, anti-inflammation, saline sprays, and then after a period of time, if you start having discolored stuff, the antibiotic. Any antibiotic of choice?
Yeah, we tend to move to the amoxicillin derivatives, Augmentin first. Those are what we recommend. They're appropriate for the bacterial spectrum that cause sinus infections, and we would typically pair that with saline irrigations and probably with a nasal steroid to try to get the inflammation out of the nose with a topical nasal steroid misting spray, many of which are now available over the counter.
And so you get pretty good results with that.
Excellent results.
And if you don't with the antibiotic, then what's the course there? How long before you start thinking of chronic?
Well, we live in a world of bacterial resistance today, and so that complicates treatment in some circumstances. And so if you don't respond to that first line antibiotic, then your physician will generally change the class to a different type of antibiotic and give you another 10-day course, and we hope that you respond to that one. And if you look at today's bacteria that are out there, many of them are resistant to antibiotics because we've given so many antibiotics for viral infections. And so it's important for the public to know that your doctor's not being mean or lacking compassion. It's that they're trying to do the right thing for the general health of our population.